Hello, my name's Griff. I'm an emergency department nurse, and I am going to be performing a full head-to-toe physical nursing assessment on my patient Christine here. Let me just wash my hands really quick. Alright, and I think our hand sanitizer got a little overzealous there. Christine, nice to meet you. My name's Griff. I'm going to be your nurse today. I'm going to be taking a look at you, okay?
Okay.
First things first, I'm going to be looking at your facial features. Your face is nice and symmetrical here. Go ahead and smile for me. Okay, can you give me a frown? Lift up your eyebrows for me. Close your eyes nice and tight. Don't let me open them. Okay, puff your cheeks out for me. Alright, I'm going to take a look in your eyes here. Go ahead and look up at the ceiling. Your eyes look good here. Let me grab my pen light. Okay, look right at my nose. Okay, follow the light. Alright, put this back here. Follow my finger with your eyes. I'm going to come right into your nose and make you a little cross-eyed. Back out. Look right at the top of the door right there. Okay, and refocus on my finger. Good. I'm just going to feel your tear glands here. And your lacrimal glands. Okay, we're going to move on to your nose too, okay?
Okay.
So there's no drainage from her nose right now. Everything is symmetrical. Go ahead and plug one side. Blow out. Breathe in. So that's clear and unobstructed. Do the same with the other one though. Breathe out and breathe in. Okay, good. We're going to move on to your ears here. The ears are nice and elastic. No color, no disfiguration there. I'm going to be rubbing my hands together and moving further away from your ears. When you can't hear that anymore, I want you to let me know, okay?
Okay. Now. Now.
Okay, you're going to feel your jaw here. Open and close. Open and close. Alright. I'm going to take a look in your mouth here really quick. Open up and stick out your tongue. Okay. Nice and moist in there and pink. Say ah. And your tonsils are normal size and you still have them. Alright. Next I'm going to feel your lymph nodes, okay, in the back of your head here. Behind your ears. Right in front of your ears. You're going to come down through your face. Come down your neck. Okay, and while we're here, we'll check your skin parameters. Those are good, you're well hydrated. Okay, I'm going to have you spin around now. I'm going to take a look at your back, okay?
Okay.
Okay, I'm going to be tapping on your back, alright?
Okay.
Just breathe normal for me. So we have no dullness here, everything sounds good. Any dullness would be indicating some sort of infiltrate in your lungs. Okay, we're going to keep this right here. I'm going to take a listen with my stethoscope. Every time you feel it, take a deep breath in and out, okay?
Okay.
And out. In and out. Okay, I'm going to put my hands on your lower back and kind of pinch in here. I want you to take a nice deep breath in. Alright. We get a nice equal expansion of your lungs and your chest here. Spin back around towards me now. Okay, I'm going to listen to your lungs from the front and then your heart sounds, okay?
Okay.
Nice deep breath in. And out. In. And out. In. And out. In. And out. In. Out. One more. Okay, now I'm going to listen to your heart sounds, so just breathe normal. All your heart sounds sound good, your apical pulse is normal and regular.
Okay.
We have no bruits or no murmurs that I can hear right now, okay? Can you go ahead and stay sitting right there? I'm actually going to do some pulses here, okay? I want to feel your temporal pulses. I'm going to listen to those on either side too. Okay. I'm going to feel your carotid pulses here too. I'm going to listen to your carotid pulses. And those sound good, clear of any bruit. I'm going to take a feel to your thyroid here too, okay?
Okay.
Come around back. Alright, what I'm going to have you do is tilt your head front and to the left a little bit. I'm going to have you swallow. I'm going to give you that water in case you need to do that. Good. Now we're going to do the same on the other side. Just kind of going to deplace your trachea again. Alright, good. Tight quarters. Okay, go ahead and stick your hands out for me here. Nice capillary refill, your hands are pink. Go ahead and squeeze my fingers nice and tight. Good. Alright, you can put this hand down for now. I want you to make a fist as tight as you can. Alright, I'm going to press right here. Go ahead and open up your hand for me. I'm going to release right here. You have good return circulation there. Turn nice and pink again. Squeeze. Okay, one more time. Alright, good. Go ahead and lay down for me, okay? We're going to take a look at your abdomen. Scoop you up here. Alright, now lift this up here. Just going to listen with my stethoscope right now, okay?
Okay.
Alright, and your bowel sounds are active. I don't hear any bruise with the circulation in your abdomen either. Alright, I'm going to tap and you just keep laying right there, okay?
Okay.
One more. Good. I'm going to push down. You let me know if you have any tenderness, okay?
Okay.
Any pain up by your liver here?
Nope.
By your stomach? Down here? Okay. Cover you back up a little bit. I need to feel your inguinal lymph nodes. Okay, it's going to tickle and then I'm going to feel for your femoral pulses. I know it tickles. Hang on. Everybody always laughs at this. Alright, I'm going to feel your femoral pulse here. Good. You're gonna feel the pulses behind your knees. And then we're gonna come to your ankles here. And on the top of your feet. Good. You're gonna bend your leg up. Just relax. Do you have any pain or tenderness in your
Nope.
calf? What about on this side?
Nope.
Okay, I'm gonna bring you back down here. For the last part of the test, I'm just gonna have you stand up. Put your feet right together just like this. Put your hands out in front of you. Nice and flat. Good. Close your eyes for me. And if you feel dizzy, I'll catch you if you fall. So I'm gonna kinda knock you off balance. I want you to correct yourself. Okay, good. That's the end of our physical assessment here. All lung sounds were good. Her abdomen checked out fine. Her face and all her structures are perfectly symmetrical. There's no odd sounds with her lung sounds or her abdominal sounds. She's got good, strong pulses everywhere. And last but not least, I don't know if I missed it or not. I'll check your radial pulses, but we already know with Alan's test that you have good circulation there. So, thank you for being my patient.
Thank you.
And like I said, my name's Griff, and I'm an emergency department nurse, and you guys have a good day.
Ready?
Mm-hmm.
And action. Hello, my name is Dan, and I'll be doing a head-to-toe assessment on you. And the first thing I'm going to do when I come into the room is I'm going to ID the patient. So I'm going to take the wristband, scan it, and then can I have you repeat your first and last name and date of birth?
Kira Sutton, 3/19/03.
Okay, and then I'm going to wash my hands, and then I'm going to make sure the temperature in the room is correct and that the lighting is appropriate as well. At this time, I'm also going to do my general survey. So I'm going to look at things such as the nutritional status, skin color and tone, sexual development, make sure they appear to be their stated age, their nutritional status, their range of motion, body symmetry, their facial expressions, and their posture. And then at this time, I'm going to assess their vital signs, and they were all within normal limits. I also weighed my patient and calculated their BMI. Then I'm going to give them their 4 unrelated words to test their new learning, which is wall, bed, hair, sky. All right.
Wall, bed, hair, sky.
Wall, bed, hair, sky.
Got it.
All right. Now I'm going to focus on the head and face. And the first thing actually before I do the head and face, I'm going to close the curtain to assure privacy for the patient. Then I'm going to go into the head and face. So the first thing I'm going to look at is the cranium, the hair distribution, and the scalp. And it is normocephalic, there's even hair distribution, there's no lesions, and the head is symmetrical to the body. Then I'm going to test cranial nerve 7 by having them close their eyes real tight, and then smile, and then frown. Okay, good. Now I'm going to palpate their temporal artery, and it is smooth and has even rhythm, and it's equal. Then I'm going to palpate their temporal mandibular joint and have them open and close, open and close. And it is even, smooth, there's no tenderness, and there's no crepitation present as well. Now I'm going to palpate their or her frontal sinuses, and there's no pain or tenderness. And then I'm going to palpate their maxillary sinuses, and there's no pain or tenderness. All right. Now I'm going to move on to the eyes. And the first thing I'm going to do is test their near sight. I'm going to hold this at about arm's length and have them read these first 3 lines here.
Attack, they seem to yield to the weight of the Roman power, they soon buy a signal.
Good. The patient was able to perform. Next, I am going to inspect their external eye structures, such as their eyelashes, their eyelids, their eyebrows, and the eyeballs, and they are all symmetrical. Now I'm going to look at the conjunctiva, which is pink and moist. Then I'm going to look at the sclera, which is white and glossy. And the cornea is smooth, clear, with no cloudiness. All right, now I'm going to do the cornea light reflex test. I'm going to have the patient look off into the distance, shine a light, and look for equal reflection in each eye. And make sure the reflection's in the same spot in each eye from about 12 inches away. Now I'm going to do the pupillary light reflex, and I'm going to bring the light in from the side. And look for the pupils to constrict evenly in each eye. Then I'm going to do the accommodation test, and I'm going to start from about a foot away and move in towards the nose. Good. And I'm looking for the pupils to constrict and the eyes to move inward on the same axis. And that tests, or no, now I'm going to do the 6 cardinal positions of gaze, which test cranial nerves 3, 4, and 6. And the patient was able to perform. All right. Now can you repeat your 4 unrelated words for me?
Wall, bed, hair, sky.
The patient got 4 out of 4. All right, now moving on to the ears. And the first thing I'm looking at is the external ear structures, and the ear canal are both symmetrical and there's no deformities. I'm then going to palpate the auricle and the tragus, and there's no pain or tenderness in either. I'm then going to do the whisper test, which tests cranial nerve 8. So I'm going to go behind the patient from about 2 feet away, and I'm going to have them cover their right ear, and I'm going to whisper 3 letters.
ABG.
And they got 3 out of 3. Now I have them cover the left ear.
AB7.
And they got 3 out of 3 again. So 6 out of 6 total. All right. Now moving on to the nose. And the first thing I'm looking at is that the nose is symmetrical in midline and it's proportionate to the face. I'm then going to test the patency of the nares. So I'm going to plug one nostril and have them breathe in. And the other. Good. And there's bilateral patency in each nostril. I'm then going to look inspect the nasal mucosa, which is pink and moist. The turbinates are visible, and the septum is non-deviated. Next, I'm going to do the smell test, and that is cranial nerve 1. So I'm going to have the patient close their eyes. And can you tell me what this is?
Alcohol.
That's good. And then this.
Coffee.
Good. The patient was able to perform. All right. Now I'm going to move on to the mouth and throat. And the first thing I'm looking at is the lips and the buccal mucosa, which is pink and moist, and there are no cracks or lesions. Then I'm going to look at the teeth. You smile for me. The teeth are white, straight, and even, and the gums have tight margins. I'm then going to look at the actually, I'm going to have the patient stick out their tongue, and there is no tremors, and that tests cranial nerve 12. Now I am going to have the patient open their mouth. I'm going to inspect the hard palate, which is whitish with transverse rugae, and the soft palate is smooth, pink, and moist. I'm then going to do the uvula test. So if I have you open your mouth and say ah, and the uvula moves upward on the midline, and that's testing cranial nerve 10. Now I'm going to look at the tonsils. And the tonsils are barely visible, so there is a 1+ grade, and they are rough. Next, I'm going to test the gag reflex. Is this one?
No, I got a new one.
Oh, you got a new one?
Mm-hmm.
Okay, good. I'm going to test the gag reflex, which is cranial nerve 9. Good. It is intact. There's no garbage, okay. All right, now I'm going to move on to the neck. And the first thing I'm looking at is that the neck is symmetrical with the head, and the head is still and erect, and there are no pulsations or lumps visible. I'm then going to palpate the carotid artery. All right. I'm then going to I'm going to auscultate the carotid artery. And I'm going to do it with the bell. And there's 3 spots. I'm going to listen at the angle of the jaw, the mid-cervical, and then the base of the neck. And the rate is even, and there are no adventitious sounds. While I'm doing that, I'm also having the person exhale while I do it as well. All right. Now I'm going to palpate the trachea, which is midline. And then I'm going to test the neck range of motion. So I'm going to have him look to the left, the right, chin to the chest, and tip the head back. And then I'm going to do the shoulder shrug test, which tests cranial nerve 11. And I'm against my pressure. I'm going to have good. And there's bilateral.
Do it one more time.
One more time. And there is bilateral strength. Now I'm going to go to the back of the patient and do the posterior chest. And the first thing I'm going to do is look at the rib configuration, and they are downward sloping and symmetrical. I'm then gonna look for symmetrical expansion. And that's at rib 9 and 10. I'm gonna place my hands in a W, pinch a little bit of skin, and then have them breathe in and out. And there is symmetrical expansion. I'm then gonna do the tactile fremitus. So I'm gonna have the patient say blue moon,
Blue moon, blue moon, blue moon, blue moon.
and there is equal vibration. I'm then going to palpate the spinous process, and they are in a straight line. I'm then gonna auscultate the posterior lung sounds, and there are 9 pairs, and I would listen for 1 full inspiration and expiration. And it's with the diaphragm. And it would be 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. And there are no adventitious sounds. And then now I'm going to have the patient repeat their 4 unrelated words.
Wall, bed, hair, sky.
Good. Patient got 4 out of 4. All right, now moving on to the anterior chest. And the first thing I'm going to do is assess their respirations. And there's 16 breaths per minute, and they're unlabored. I'm then going to test the skin turgor. And it returns in less than 3 seconds. And then I'm going to auscultate the anterior lung sounds, and there are 5 pairs. And I'd also listen 1 full inspiration and expiration. There's 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. And there are no adventitious sounds present. I'm now going to move on to the upper extremities. And first I'm going to inspect that they are symmetrical and there's no deformities. There's even hair distribution, and there's no visible rashes or lesions. I'm then going to palpate the upper extremities, and they are warm and there is no edema. I'm then going to do the arm or the strength test. Have them squeeze my hands. Good. And there's bilateral strength. And then I'm going to I'm going to check their nails. And the nail beds are pink, and the nail is translucent, and the capillary refill returns in less than 3 seconds. All right, now I'm going to move on to the breast examination. And there are 3 movements I'm going to have you do. I'm going to have you raise your hands above your head, and then I'm going to have you push your hands together, and then your hands on your hips, and there is no visible dimpling or retraction. All right. Now I'm going to move on to the neck or the neck vessels. I'm going to have the patient lay flat. Put that down. Oh. Wait, here we go. There we go. All right, and then I'm going to have the patient look to the left, and I'm going to visualize the jugular venous pulse, which I see. I'm then going to raise the bed, and it should disappear at 45 degrees. And it does. All right. Now I'm going to move on to the heart, and I'm going to have the bed at 25 to 30 degrees. And the first thing I'm looking at is the precordium. There's no visible heave, lift, or thrill. I'm then going to palpate the apical pulse, which is at the 5th intercostal space, mid-clavicular. I'm then going to auscultate the apical pulse for 1 full minute, and that is with the diaphragm of the stethoscope. And it is even, and there's no adventitious sounds as well. I'm now going to listen to the heart in a Z pattern. And there are 5 locations. And it's going to start with the diaphragm. And they are aortic, pulmonic, there's Erb's point, and then tricuspid and mitral. I'm then going to switch to the bell of the stethoscope and listen. Mitral, tricuspid, Erb's point, pulmonic, aortic. And there are no adventitious heart sounds or murmurs present. All right. Now moving on to the abdomen. And the first thing I'm looking at is the contour and symmetry. It is flat and symmetrical. I'm then looking at the umbilicus, which is midline. And it's inverted, and there are no visible pulsations. I'm then going to auscultate for bowel sounds in all 4 quadrants, and there should be 5 to 30 bowel sounds per minute. And if there were none, I would listen for 5 minutes. And I'm going to start in the right lower, and then right upper, and then left upper, and left lower. All right. I'm then going to auscultate the vascular sounds, and there are 7 pairs, and that is with the bell of the stethoscope. And it goes aortic, and then it's renal, and then it's iliac, and then femoral. And there are no adventitious vascular sounds in the abdomen. I'm then going to palpate with 4 fingers in all 4 quadrants, starting with the right lower, right upper, or left upper, and left lower. And the abdomen is warm. There's no so it's warm. There's no tenderness or pain. All right. Now I'm going to move. Oh, no, actually, I need to look at the demeanor of the abdomen. It is calm and there's no guarding. And then I'm going to assess the female perineal area. And then is there any itching, rashes, or do you have any difficulty urinating?
No.
Okay, good. All right, now I'm going to move to the lower extremities. And the first thing I'm looking at is that they are symmetrical. There's even hair distribution, and there's no pretibial edema. And then I'm going to palpate the pulses, and I'm going to palpate the dorsalis pedis, which is on top of the foot, and then the posterior tibial, or the anterior tibial, and then the popliteal, which is under the knee, and then I would do the femoral if it was indicated. All right. Then I'm going to, and all the pulses had a 2+ grade. Then I'm going to I'm going to look at the toes. They are pink and warm, and the capillary refill is less than 3 seconds. Now the tests I'm going to perform are the foot push test, which tests for the strength. And I'm going to push against my hands. Good. And there's bilateral strength. I'm then going to test the Babinski reflex, which is the plantar reflex. And then I'm going to draw an upside down J, and I'm going to look for the toes to curl. And if they curl, that means they are negative for the Babinski reflex. Or if they spread out, that means they're positive. And they are negative for the Babinski reflex because the toe is curled. All right. Now I'm going to move on to the neuroexamination. So I'm going to have him sit up. And the first thing I'm going to do is test for sensation. So have me close your eyes. And you're just going to tell me where I'm touching you with this cotton swab.
Face. Arm. Left arm. Neck. Right leg.
Good. So we're able to identify all 4 spots. I'm then going to do the positional assessment with their eyes still closed. And I'm going to push one finger in towards your palm and just tell me which finger it is.
My right index.
Good. Then I'm going to do the graphesthesia test. I'm going to draw a number on your hand, and you tell me which number I'm drawing.
8.
Good. Then I'm going to do the scaragnosis test. I'm going to place an object in your hand, and you just tell me what the object is.
The key.
Good. All right. Next, now you can open your eyes, and I'm going to have you do put your hands like this, and bring your fingers to your nose. Alternate. Good. Patient was able to perform. I'm then going to have you take your heel and rub it down your shin. Good. I'm then going to test your rapid movement and just pat your legs with your palms and hands back and forth. Good. Patient was able to perform. I'm then going to test their deep tendon reflex, which is their patellar reflex. And the knee jerk was present, that's good. I'm then going to do the Romberg test. Have you stand up, have you close your eyes, feet together, and I do this for 20 seconds, and light sway would be normal. All right. And then at this point, there's no indication for further mental or musculoskeletal or no indication for mental or muscular abuse. And then I'm going to have them repeat for one last time the 4 unrelated words.
Wall, bed, hair, sky.
Good. They got 4 out of 4, and they got all right. And now I'm going to wash my hands and thank the patient. So thank you very much
You're
for your
welcome.
cooperation. And then I would exit the room, and I'm done.